Hello, I'm Dr. William Ortiz. I'm a geriatrician. And because of all the misinformation pertaining to medical cannabis, I decided to make a series of educational videos to help patients. Help patients usually know how to use this medicine, use medical cannabis safely. Let's face it, the majority of my colleagues are currently not trained on how to manage the patients with use of this medication. And what I have discovered firsthand is that many of clinicians are certifying patients to use this medication and they're not properly educating them nor monitoring patients after certifying them. So my hope is that after you've used this series, you learn a little bit how it works and if it's appropriate for you as a viable medication intervention. My hope is that you avoid any harm that may be associated with its use as well. This represents centuries of abuse and misuse. The burning of cannabis produces not only psychoactive effects, but harmful byproducts of combustion as well. The proper use of cannabis requires a variety of methods of administration. For example, temperature-controlled vaporizers. Man has had an association with cannabis for thousands of years. It has been used as a scapegoat by Hollywood and others over the past 80 years. We have only most recently become reacquainted with cannabis scientifically over the past 50 years. Clinicians and patients must now work together to fully understand the uses and potential of this medicine. How does it work in your body? Even though this is very complex, I will simplify it to better understand its impact on your body. The human body is perfect. When free of disease or undamaged by trauma, there is nothing more perfect on this planet. Did you know everything in your body is in constant communication? Every cell, every tissue, every system communicates both electrically and biochemically. Cannabis directly affects the endocannabinoid system. The endocannabinoid system, or ECS, is a regulatory mechanism that directly affects homeostasis. Its purpose? To establish balance throughout your body. Let's take, for example, your nervous system and focus on a synapse in your brain. That is the communication between two nerve cells called neurons. The message begins biochemically with the release of neurotransmitters. The postsynaptic neuron receives and becomes excited, and at the same time, the postsynaptic neuron begins to synthesize and release endocannabinoids that travel back to bind to CB1 receptors. The binding of the CB1 receptors cause a reconfiguration in the G protein. This reconfiguration in G protein affects voltage-gated calcium channels along with potassium channels that cause an ion shift within the cell. These changes in charges essentially stops any further release of neurotransmitters. For example, stopping the message, I have pain. Let me point out some very important physiological effects. If you're already on medication, for example, high blood pressure, cholesterol, pain, depression, anxiety, the use of cannabis can not only affect the intended use of these medications, as well as the concentrations of these chemicals in your body. Cannabis can cause your heart to beat fast. We call that tachycardia, lasting 3 to 4 hours. Another possible side effect with the use of medical cannabis is something called orthostatic hypotension. In other words, you get up too quickly, you feel dizzy, you stand up, and you could possibly pass out. If you found this video helpful and you wish to learn more about the safe and proper use of medical cannabis, then please look to our educational series for more detail. Thank you.